When doctors graduate from medical schools and are on the streets jobless, while in public hospitals just one doctor is attending to about 60 to 70 patients per day, pressure and fatigue will certainly lead to dangerous medical errors. This situation, the ceaseless trend of brain drain and perinatal mortality, which is the deaths of babies before they are born, were major issues on the front burner at the annual scientific conference of the Lagos chapter of the Nigerian Medical Association.
In health, you don't take risk with life. That's why you do everything to ensure that you save life. But the truth of the matter is that when something goes wrong, the head of the doctor goes. The public that you are trying to protect are not even there to protect you and say, we go to the hospitals, we see the number of doctors there. Don't blame this doctor. No.
Nigeria has a very ugly perinatal and infant mortality rate, precipitated by poverty. Many pregnant women are undernourished and lack money to access proper health care.
This is totally unacceptable. We as a country, we must rise to this challenge. If our mothers at this point cannot access health for themselves and for their babies, then we have failed.
A leading cause of infant mortality is a bunch of respiratory infections which spread easily in overcrowded areas.
There are some, vaccinations that are not in the routine national program on immunization that parents have to pay, to get their children vaccinated. And some of those vaccinations are such that prevents some severe respiratory tract infection. So if the government can try as much as possible, to get it over time incorporated into the routine MPI, that's the National Program on Immunization, it would also go a long way.
When a baby does not breathe at birth, which is a major problem, oxygen does not get to the brain. That baby is brain damaged. So that's why you see so many children, mentally retarded, cerebral palsy, due to problems that were encountered at birth.
This highlight leaves some big questions. Who is that woman that wants to go into the labor ward without coming out alive? Who is that woman who wants her baby to die in her womb? The answer is no one. These doctors here say women need good medical facilities for the delivery of their babies. They also need drugs available in medical facilities as well as skilled professionals to take delivery of their babies. All of these they can't do for themselves. The reason why the government must step up its support for mothering child to curb infant and maternal mortality in Nigeria. Jacqueline Ogoh, TVC News, Lagos.